Hi everyone, this is a brief overview exploring how gestalt might be used in group counseling. So first of all, gestalt draws from existential and phenomenological approaches, so it has a very much a here and now focus. And Fitzpearl's had a kind of a real confrontative kind of edge to him. And if you haven't seen the Gloria session where you get to see him work with Gloria one-on-one, I recommend it. And that's probably what's led to more of a relational gestalt therapy approach, where there's much more emphasis placed on the relationship formed rather than being openly hostile towards the client. Uh, but Gestalt has really helped us group therapists to look at client awareness and how client awareness can be supported within the group experience. And we're not looking for interpretation, rather, this is a process oriented approach. Lots of how and when, what kind of questions. And we're looking to see, what parts of the individual might be in conflict with each other because we're seeking wholeness. And we really have to start with the quality of our awareness. And in this way, it's also, I feel like a strength-based approach in that, what's the person working with? Where are they right now? And what is really real in this moment? And what is, rather than what they are not. And we are equally paying attention to process and content in the group experience. So we're focused on the whole person and this idea of field theory, which is, I just think, one of the earlier terms or theories around recognizing that the environment or context that an individual is in is going to influence how they show up in the group experience and who they are. And so it's really definitely focused in the here and now, what's going on right in this moment. I can say that for my very first group that I ran, an IOP group, I let the group know I was really nervous in that moment, or I did a gestalt, as I called it, because they then actually, it turned out really well. They ended up sort of supporting me through that process, and we all kind of talked about what it means to do something for the first time. So it was definitely growth focused, if you will. And that's what I would say of Gestalt. It's definitely a present centered, growth focused approach that's looking at how somebody operates in the world and how that shows up in the here and now. And Gestalt wants to look at the problems as though they're occurring in the moment. And so perhaps, different people within the group experience might act out different roles of or possible selves, if you will, uh, for that person. So, talk to Abby talk to little Abby when she was a little girl, or talk to Abby when she was an adolescent, or talk to Abby when she was really angry or sad, or, and sort of experientially experience these emotions and past experiences in the moment. And we're looking at this idea of unfinished business, which are fingers, feelings, or other issues that we have from our past. Unfinished business, at this point, has kind of made it into our lexicon. It's a common phrase to use, but we just know there's like some unfinished business going on from our past that we need to deal with. Very common for trauma victims with substance abuse, PTSD, divorce, what has the person not fully worked through, and that might be leading to some self-defeating behaviors. Um, just because of my early experience in addictions, I can think of, how using can lead to delayed development. So it's often said that somebody, like if they start using drugs at 15 or 16, that kind of is typically where they are developmentally as well. And so they might have some unfinished business related to their own development, relationships that need repair. Just, these are just some examples off the top of my head in this moment about the need to work through unfinished business. And so you're really working on raising their awareness, helping them understand context, engaging in dialogue, experiential exercises. The empty chair technique, is often used through this lens. It's a very uh, active role, not directive, but definitely active. And we want clients to experiment. So, I could think for something maybe like social anxiety or something. I know this is an Ellis experiment, but it might work here too of just, I want the client in the group to go around and ask each member, would they like to do something social together and try out different ways of doing that. That might be one example of an experiment. But this is a very active and energetic approach to group. And you do definitely need to have a lot of safety established if you're going to go this route. And of course, at the heart of this approach and all counseling approaches is the client-counselor relationship. It's definitely focuses on a dialogue and the importance of dialogue. Since we're never done developing, dialogue is continually important. And we want to have authentic dialogue, and we're looking for acceptance, compassion, and self-expression. We're really looking at language patterns, again, which isn't too different from CBT, a different way of approaching it, but definitely similar ideas. What are can't statements, letting you know there's sort of a barrier there. Shoulds, oughts, I often say to clients, that sounds like a shoulda, woulda, coulda, what can we do in this moment? Qualifiers and disclaimers, I'm too busy, I'm too anxious, uh, just sort of these things that come up that make it difficult for clients to, through this lens, take responsibility to make change. And also definitely paying attention to nonverbal language. There's a big emphasis on the body through this lens as well. So if you see a client maybe shaking their leg when they're really anxious, you might ask them to talk about that a little bit, what's going on in the body, maybe even exaggerate it as a way to really understand it's the phenomenological experience of it. Maybe you want to have that body part talk back to the client. What's that body part telling the client? Dream work is important in Gestalt approaches, and it's again not about interpretation, but about experiencing the dreams as though they are happening right now in this moment, and without judgment. And then members get to interact with different parts of the dream and see what type of awareness comes from that experience. And so what you would do if you're interested in doing some dream work in groups is to, you have the different various aspects of the person's dream having a dialogue, and then members get to explore that experience and talk about how they were affected in the here and now. Gestalt is great for schools because of its highly experiential nature. How many of us do role plays? See what else is often commonly used in schools. I mean, certainly the experiments. Kids often think that they're not best friends anymore, and it'll often be an experiment to tell a child, I'd like you to just send that friend a text and see if that's actually true. And Gestalt therapy isn't always the best pick for, group members that are going to be real self-conscious. Getting people up and acting if they have social anxiety or other anxiety disorders, or the group is just not that safe, maybe an open group where people are coming in and out. It might not be the safest space to engage in some of these techniques. There does seem to, of course, be some issues around because it is so active and experiential, for cultures that value being more emotionally reserved, they could certainly find these very active and engaged interventions off-putting. Also, there's a lot of emphasis, as there are on all these early theoretical approaches, on the individual taking responsibility. And of course, we know that often it's about systems of oppression. What I really take from Gestalt is this idea that we can be experiential in the here and now, and that that's really what's important. And that's really, when I'm coming back to, and I ask, well, how are people feeling in this moment with me? That's sort of always a go-to question for me in counseling in both individual and group. That I'm drawing that from Gestalt, as well as the idea of having a real and true authentic dialogue and authentic relationship. And of course, the use of creativity and spontaneity. This week we'll also take a look at psychodrama and using creativity and other creative methods in counseling. So you can see here the basis for where some of these early interventions came from. And I agree with this. I think that Gestalt really needs some higher functioning folks. And so you need people who can at least engage in some abstract reasoning to really understand why and how these interventions might potentially support them. The power could definitely be abused because there is a definite focus on, the I don't want to say the counselor is expert, but because it came out of a time period where the norm was that the counselor was in expert mode, I think there are some vestiges of that idea from that part of our history within this current Gestalt approach. And we just want to be aware that all of these kind of interventions can be extremely emotionally provocative, and so we always need to process afterwards. All right, and that's a brief overview of Gestalt.